This is Tom Lee, editor-in-chief of NEJM Catalyst, and we're talking today with Dan Greenleaf, who has been the CEO for just over a year now of Dooley Health and Care, the largest independent multi-specialty physician-directed medical group in the country. Dan and I were on a panel recently, and I found his description of their strategy interesting. They aren't trying to be acquired by some bigger organization. So what are they doing? Dan agreed to talk with us today. So Dan, can you give a quick description of Dooley today for audience members who might not be familiar?
Tom, thank you so much for having me. It's a pleasure to have the opportunity to speak with you. So Dooley is, as Tom said, is the largest independent multi-specialty group in the country. We have about 1,500 clinicians, and approximately 1,000 of those are doctors. We serve 1 million unique patients in the Chicagoland area. We handle approximately 5.5 million visits per year. We have 190 locations, and then we're essentially broken up into 4 business units to include DuPage Medical Group, which is broader Chicago, South Bend Clinic, which is in South Bend, Indiana, and then Quincy Medical Group, which is in Southern Illinois. And then we also have a value-based care business. We have, along with the 1 million patients that we serve, within that group, approximately 100,000 are in a value-based care product, so either Medicare Advantage or ACO REACH. We also have 220,000 patients that are partial risk. We are as you probably being in Chicago, we're in the 3rd largest market in the U.S. We also have a fairly robust ancillary business as well. So we've got 5 ambulatory surgery centers. We have the busiest ambulatory surgery in those 5. We have the busiest ambulatory surgery center in all of Illinois. We have 5 labs and 20 places we do draws. We have 58 infusion chairs, and we also have a radiology business. And the other thing that I like to share with people is just the quality of work that our physician community does. We have a net promoter score in the 70s, which is world class. So think someone like a Starbucks or even on Amazon or Netflix or JetBlue. If you've had any interactions with those types of entities, I think you know what the patient or customer experience is like. And the other thing I'm just really proud of is that 88% of our patients score our physicians, and I know you'll appreciate this, Tom, an 88, a 5 or higher, 88 or 5 or higher, which is highly satisfied, which we just had a group come in and look at it. We use Press Ganey as well. But the gentleman said it was the single best score he's ever seen. And it's remarkable. And so our physicians do an incredible job. 600 of our physicians are shareholders. They own about $500 million of the company. So they have a significant stake in the outcome of the organization as well. So I think the incentives, if you will, for our physicians I think they're very well aligned in terms of what they do on the patient care side, but they're also very well aligned with what we're trying to do strategically with the organization.
Now, Dooley does have a great reputation for quality, but I've been especially interested in Dooley for many years because of its commitment to value-based care, the 4th of those 4 groups that you talked about. Now, we are living in a time where some organizations are backing away from value-based care, and others at least say that they're doubling down and plunging in. Can you describe your thinking these days on value-based care for Dooley?
Yeah, I would say that it's here to stay, Tom, and I don't I don't feel like, I know some people at one point when I joined thought, how difficult is it to have a foot in each canoe, and I don't really see that as necessarily an issue. I look at what the average length of service for a patient at Dooley is 5 years. We've got cohorts that are in excess of 10 years. And the way I think about it is I want to meet the patient where he or she is. And if that's in their, if you will, their fee for service life cycle, great. If that's because we can provide an alternative to a hospital for a procedure, so they go to our ambulatory surgery centers, great. Similarly, for our infusion centers and or for labs, just out of, in many respects, out of convenience to the patient. So I look at it, it's like, as the patient moves along in his or her, if you will, care life cycle, we want to be there for them. And in some instances, it's going to be fee for service. Some instances, it's going to be shared risk. In some instances, it's going to be value-based care, either Medicare Advantage or ACO REACH. And what I don't like to get too focused on is like kind of financial engineering. And in some respects, value-based care is, a type of financial engineering for the healthcare system to hopefully drive better outcomes. But at the end of the day, for me and for the organization, it's really about the patient and what season of life is that patient in, and we're going to be there for all seasons for them. And we think there's enormous value in having a value-based care business combined with a fee-for-service business. I have to say fee-for-service isn't going anywhere, nor is value-based care. Both of these ways that we care for patients are here to stay, and I think it's important that we can provide those services to our patients, regardless of what his or her preference is.
Well, that is a refreshing statement, which not many people are saying, which is that you're less interested in what payment model patients are in than other more important topics. You're not trying to play a game by shifting to one payment model or another, but you're focusing on something else. So what are those other things? When you are laying out the big strategic theme for where you are pushing Dooley to get better, it's not shifting to one payer or another payer, it's something else. What are the themes?
Well, I know you heard me talk about this, Tom, a little bit at McDermott, but first and foremost, I feel like my most important responsibility is to maintain the sacredness of the patient clinician relationship, and patient predominantly physician relationship, and ensuring that interaction is as valuable for both the physician and the patient as possible. And so my job, I think, fundamentally is to reduce friction and to try to ensure that we're making this environment as easy for the physician as well as the patient. And both are having, the physicians are able to work on the upper end of their license, and the patients having not only an exceptional experience, but also a great outcome on top of it. And I'm also a fundamental believer in physician autonomy. And I do believe that, one of the reasons why physicians are attracted to Dooley is because of the autonomy we afford them. And they also have a network of physicians that are that are I think they view as colleagues and people that they can rely on, and for a multitude of reasons. But it all really boils down to, Tom, this voice of the customer. And when I think about the voice of the customer, it starts with the patient, then it moves on to our clinicians and predominantly the physicians, and then it moves on to our teammates, our communities, the payers, the hospital systems. They're all part of the voice of the customer. And we also have a very strong view on, partnerships are important. And so that's kind of it in a nutshell. I think I've shared with you that the company has 5 priorities, and those are, from a CEO standpoint, I've got to ensure that I'm putting the right people in the right seats. So the team that is delivering kind of the operational excellence, is that we're putting the best team on the field to support our patients and physicians. I've talked about the voice of the customer and how important it is that the organization never forgets that patient could be your mother, could be your father, could be your sibling, could be your significant other, could be your grandparent, could be your children. And that's why I feel that's such an important consideration, and why I believe that relationship is so sacred. And then the third thing is single repeatable model, and that's best practices, that's reduction of variation. It's ensuring that every single day we're thinking about how do we make the patient and the physician's lives better, by way of what we're applying from a best practice standpoint. And that covers a whole gamut of things. The fourth one is, I will say, is we're not going to grow, Tom, for the sake of growing. We're going to grow because it's I would describe it as profitable growth. It's just not, I think there was an era that, and maybe we're still on the tail end of that, where people just grew without really any considerations of reinvesting back in the business. And that's something, we have to unlock value, so that we can reinvest back in the business, so that we can supercharge, so that we can, adopt the best technology, so that we can go out and recruit the best physicians and the best clinicians. And then the fifth one is just innovation automation. And we're doing a lot of things on that front too. One of the beauties of our business is, because we have 190 locations, I feel like I've got 190 locations where we can incubate things. And so we're doing a bunch of things in technology where we're doing proof of concepts with small groups of physicians, and if they prove out, we believe that it's just going to be a much easier road to roll them out once we've got some people to support it. So that's what I would say in terms of the overlay of what we're doing.
Well, your comments remind me of something Aaron Martin, who is an innovation leader at Amazon, said in one of our meetings, which is that at Amazon, they figured out after a while in the early days that the two parties that really mattered were the authors and the readers, and that everyone else was secondary, and that they should be focusing their innovations on making things better for one or both of those two key parties. And it seems like you've got the same kind of perspective, which is that what really matters are the patients and the clinicians, very often the physicians. And that is probably helpful in helping you focus and figure out whether you're actually making progress or not. So are you making progress? What are, how is it going overall? And are there 2 or 3 steps that you've been taking to make life better for patients or clinicians that you are most proud of?
Yeah, I think there's a number of things. When I got to the organization, I think there was a little bit of a riff between the physicians and maybe the operational team, and so it was really important from my perspective is trying to understand that. And one of the ways we did that is through an engagement survey. One of the ways that I do it is I visit the clinics. I've been to approximately 10 clinics already. I try to hit one almost every other week, and we've got other people on the management team that are doing that, and we're really trying to understand what we can do to be helpful. And I know you know this, but there's nothing like walking a mile in somebody's boots and really hearing them out and really being there to listen. For example, on one of the feedback we got was, was around communications, and then we drilled into that a little more, and we just found out there were some gaps in certain things, like, do they really understand, the FICOM model? Do they understand what's happening in the areas? You can appreciate this med mal. And so we've put together these kind of monthly seminars that we're doing, and it's really based on the feedback that the physician community's provided us. And the last two we've had almost 500 people in attendance. And so obviously the subjects that we're picking are ones that there's a tremendous amount of interest in. I would also say that, physicians in general are very sequential thinkers. There's associative thinkers and sequential thinkers. And, I just don't, this idea of, like, you can give an inspirational vision to the physicians, but if they don't see, like, point A to point B to point C to point D, you lose them. And so you can't say things like, imagine this, just suppose for a minute, and you have no substance behind that. So we take this, like, say-do ratio very seriously, and I also I do what I say I'm going to do, and I also share with the physician community that trust is built on trustworthiness, and trustworthiness is a function of competence and character. And I don't expect you to trust me immediately, as I have to earn that. And in many respects, I believe I have to earn that every day. And so some of the things, like, we've done is for example, like, one of the things we heard, and it sounds pretty basic, but tap to access, Tom. Instead of somebody logging into their computer 25 times a day, imagine if we could provide them a tap to access means, so they don't have to log in. I mean, it sounds so simple. Even having for the patient, is having credit card readers at work. And actually, one of the things we've implemented, I know, again, it's going to sound that doesn't sound like rock science, but believe it or not, the patients prefer to pay at the time of visit, and the company historically not collected the patient's dollars up front that they were responsible for. And so 6 months later, we'd send them, and if that didn't work, that would just that would cascade into less favorable perception of the company. One of the challenges we've also had, and I know you can appreciate this, Tom, is that some of our physicians weren't good at the process around entering notes. And we evaluated what caused burnout or lack of satisfaction. It's incredible how much of that revolved around the 3 hours at night that they would have to spend entering notes on the patients they saw that day. So we have a couple of physicians who are involved in the health and wellness of our physician community. And when we do have problems with, for example, physicians who have difficulty entering notes or don't have a good process around that, they work with them. And it's really incredible to see the satisfaction changes, as we measure it beforehand and after, the satisfaction scores with the patients. And so it's like and even things like, some of the things we've done with our, we're largely cloud-based now, which is, we've almost eliminated any cybersecurity issues as a result of that. But the other byproduct of that is things just move faster now too. So, we might have like 2 times the speed that we used to have in terms of, how our computer systems are working. And you could imagine like just how much time that saves. We one of the other areas that, we got complaints about was our call centers. And, I'm happy to say that, the work we did there has made a massive difference on that experience for the patient. We got a score of 88 there too, top box, Tom, which is just extraordinary. And then the other one was revenue cycle management. And, we had some challenges with one of the companies we outsourced with, and we've made some pretty significant changes there just to make things better. But I know there's a host of things, but really most of these things were around things we heard from the patient or things that we heard from the physicians, and then we went out and figured out how to make them better.
Yeah. Well, I think this is very helpful in that you remind me of something Michael Porter used to say, which is that operational excellence is 90% of management and leadership. And he was a strategy guy, but he said you can have the most brilliant strategy in the world, but if you don't have great operational effectiveness, you might as well go home. Mm-hmm. And you are working relentlessly on a whole range of issues that are relevant to improving the life of patients and improving the life of physicians and other clinicians. And I think that the work you're doing will bring clarity as well as insights about what should be the focus and how to improve to many, many other people in healthcare. So I want to thank you for sharing with us, and I hope you and your colleagues will publish some of it in NEJM Catalyst. But otherwise, I'll be coming back and interviewing you again soon.
Okay. Thank you very much, Tom.